Hi, Dr. Sasse here from the Continence Center in Nevada. I was asked recently about people with neurologic conditions and specifically multiple sclerosis and how best to resolve bladder and bowel incontinence that arises either directly due to that condition or associated with it. And this is a pretty timely opportunity to speak to that because we're just finishing up a research project at our center together with one of our medical students at the University of Nevada School of Medicine to examine that in our own patients. And what we found is very much in keeping with the published literature. Let me start by saying that the way that we approach bladder incontinence and fecal incontinence is to do an assessment and then try quickly to see if the person is an excellent candidate for sacral neuromodulation, which is by far the most effective treatment for the problem. We are dealing with a little bit of a legacy health insurance system of checks and requirements, which actually mandates that people use drugs which are not recommended and have adverse side effects, including memory disturbance, and try therapies that just don't work before approving sacral neuromodulation. And there are good reasons why it started that way, but today the science and the published literature is very compelling, and experience of centers like ours is incredibly compelling that sacral neuromodulation is really the most effective tool that really restores people's quality of life and allows them to get back out in the world and generally stop having to wear diapers and pads and look for a bathroom every, couple of minutes wherever they go and really, curtail their social life. So we believe in that therapy quite a bit, and we've had tremendous success with it. One thing that's a little peculiar is that Medicare guidelines and many of the health insurance guidelines often have an exclusion that denies the therapy availability for people with multiple sclerosis specifically, or people with other neurological conditions more generally. Which is strange because the treatment itself, sacral neuromodulation, is a way to cause some stimulation, some very subtle and sophisticated computer-generated signal to the pelvic floor nerves and therefore muscles to restore pelvic floor activity and restore the bowel and bladder sphincters and restore bowel control and eliminate overactive bladder. Highly effective therapy, well proven, but for some reason that exclusion got written into the very early policy language and was never really removed. So we've encountered this many times where we've had patients who are suffering dreadfully with terrible bladder and bowel incontinence related to multiple sclerosis, only to find that while their neurologist recommends sacral neuromodulation, all other therapies have failed. We recommend it based on published literature and our experience, but the insurance company will refuse it because of these old legacy guidelines which are outdated and not supported by the science. So that's a little frustrating. So that's the background for me just speaking to this a little bit today. So what we found in looking at our patients over the course of the last several years is that to no one's surprise in our clinic, sacral neuromodulation has been highly effective. In fact, several of the patients have had terrible bladder incontinence with wearing level 4, 5, and 6 of the thickest, heaviest pads and diapers, and have tried every medication, done extensive pelvic floor physical therapy work, and have had no relief, only to find that sacral neuromodulation produced a near 100% resolution of their symptoms. So effective is that therapy in that condition. So not only is sacral neuromodulation at least as effective as it is in the rest of the population, in our experience at the Continence Center, it may actually be more effective because of the nature of the incontinence symptoms that have arisen being related to multiple sclerosis. So we will soon be publishing our findings. I would just say that there are many other authors and centers who have already published similar findings over the years, and virtually all of them show that the therapy is effective for this group of individuals. And so it's really well past time for those guidelines to be fixed and corrected and to eliminate those exclusions for people who have multiple sclerosis specifically, or who have other neurologic conditions as the basis for their bowel and bladder incontinence, because there really is just no support for, there's really no peer-reviewed or scientific, nor is there really any biological rationale for why we should exclude those people from the treatment that works the best for this dreadful condition of severe bowel and bladder incontinence. In fact, quite the reverse. These people may in fact be the best candidates for it. So we've had generally moderate to good success in explaining and painstakingly appealing and gaining insurance authorization to help many of our patients undergo sacral neuromodulation. And as I say, now that we've formally reviewed the cases and re-interviewed these patients now, in many cases years later, we will be publishing the findings that sacral neuromodulation has been extremely effective as a treatment of both bladder and bowel incontinence among people specifically with multiple sclerosis, that as a neurologic condition is either the cause or related to their bowel and bladder incontinence. Hopefully those policy changes are coming soon down the road. Hopefully the neurology community is more and more aware of this particular treatment. I will say too of note that in many cases the neurologists never really asked about this condition or never really offered much in the way of therapies for it. They have a lot on their plate dealing with multiple sclerosis and juggling medication therapies and asking about other symptoms that may be going on. But sometimes that one was ignored, just as it is among other doctors sometimes. And partly that stems from not knowing that there is very effective therapy and also not really understanding how profound the impact is upon someone who is having to wear diapers and spend money on pads and is spending so much of their time worrying about where a bathroom is, and frankly just avoiding going out in public because of it. But once they understand it, and once they understand that the therapy is highly effective, I think that we'll see more people who are suffering with this be able to get help. So that's certainly our goal at the Continence Center, is to try to help resolve this problem for people. So I hope this has been informative about the effectiveness of the therapy, sacral neuromodulation. A 20-minute procedure that's super safe and not very invasive, not painful, easy to do. Covered by insurance, except when you have to fight through those exclusions. So that can take a little bit of extra legwork. But I hope this has been helpful in clearing up that indeed the therapy is highly effective when those conditions are present. All right, I wish you the very best of health and have a wonderful new year.